of air into the lungs from the nose. That means through the nose, the back of the nose, the back of the throat, through your larynx and windpipe into the lungs. If this is obstructed, the person cannot breathe. And the simplest way to open it is to push the head back, but that you have to do very gently. You have to use the two hand technique as seen in this picture. You can see that one hand is on the forehead, the other hand, two fingers straightened, is holding the chin, and a simultaneous application of force will gently tilt the head back, and that will open the throat. And now that you have opened the airway, check again whether the person is breathing. A successful opening may restore the breathing immediately. So how to check for breathing? You use your three senses at the same time to check for breathing. One, you can look at the chest and abdomen whether it is moving. Secondly, you use your ear to listen to the air movement from the nose, or if the mouth is open, from the mouth. And then you use the cheek to feel the air current coming out of the nose. So every expiration will give a blast of air onto your cheek. So at one look, you get three different sensations. You get to hear, you get to feel, and you get to see. And then you know. And how much can you wait? Maximum 10 seconds before deciding whether the person requires artificial respiration. And this is how you give the artificial respiration. I'll tell you in the beginning, I'll warn you not to do it on a stranger. You may not know why he has collapsed. He may have COVID. He may have consumed some poison. Nowadays, nobody does this kind of mouth-to-mouth resuscitation. In hospitals, it has never been done because we use equipment. Unless it's somebody known to you very well and you're very sure that that person doesn't have a disease or has not consumed any poison, you shouldn't be doing it. You can make a fist in the shape of a tube and use it to blow into the mouth. It's not very effective, but that is, of course, a compromise that you have to accept. So when you breathe into the mouth, you have to close off the nostrils with the fingers of one hand. With the second hand, keep the chin lifted up so that the airway is open, and then you seal your mouth around the person's lips and blow out. Please note that blowing out is not like blowing a balloon. You are trying to inflate the balloon, your movement is different from what you're supposed to do in your breathing out into the person's mouth. Here you have to breathe out without any restriction from your throat, and that too breathe out for a period of 1 second for every breath. So instead of breathing out foo, which is not at all effective and it will not go in, the breath, your expiration should be open mouthed and your mouth sealed around the lips of the person. That's why nobody does it in a hospital. And no, I wouldn't recommend you. You can still have a resuscitation done without giving artificial breaths, just by giving external cardiac massage, where you don't stand any risk of contracting a disease or getting any kind of threat to your health. So now that is circulation, ABC. When you have this circulation to be restarted, you have to keep this one hand of the heel of one hand on one lower part of the chest, and then use your other hand to lock the fingers and keep it lifted so only the heel of the palm contacts the body. And then you can press down to about 4 to 5 centimeters, about 2 inches. Aim at a rate of 100 pushes a minute, and you push not with bent elbows but with straight elbows. You have to lock your elbows, and then only you should be pushing. That means you are compressing the chest from outside so that the heart is also compressed, and this is creating an artificial pumping action that will pump blood to the different parts of the body and primarily to the brain. And if you are able to give artificial respirations in between, you are getting oxygen also into the blood. So the ratio for doing that is 30:2. You give 30 compressions at the rate of 100 per minute and stop and give 2 rescue breaths. It is a very tiring process. One person alone cannot do it. You should be getting help. And when help arrives, one person can do the chest compression, the other person give the artificial respiration. Or you can switch between these two procedures, or also you can have a substitute coming and doing it, because it is not easy. The person doing CPR will tire out very fast, because you have to compress the rib cage in such a way that the heart is also compressed. So so if there are two people, then you will be able to do it very easily.
Sir, can I just interrupt you for a minute?
Yes, ma'am.
Matthew, sir. Sir,
Yes.
there is someone who has, I think, scribbled on your screen.
Yeah,
so
I
can you
signed
just
that.
stop sharing and reshare again?
Okay.
Yes, yes. Because someone has scribbled on your screen. So
I saw
you can
that.
just
I thought it's
stop
okay.
and reshare again.
Fine, it's okay. Actually, I was
And requesting participants also to avoid doing that.
Please heed our advice.
Yeah, you can reshare the screen, sir.
Yeah, in fact, I was trying to stop the presentation and would start my video. So I want you to learn CPR very well. This is of course not a substitute for a first aid course, but at least you will learn. So when you go for this first aid course, it will be pretty easy for you. So see this video. I'm going to share this video. Is that visible?
Yes, sir, it's visible. But just the volume, I think, needs to be.
Now that the airway is open, you need to look down the chest, listen with your cheek, and feel with your hands to see if they are breathing. Look, listen, and feel for a minimum of 10 seconds. You're looking for 2 to 4 normal breaths within that time. If there is no breath, that's the time to do CPR. If you shouted for help and no one has arrived, at this point you need to dial the ambulance yourself. Do this by calling 999 or 112 in European countries. To begin CPR, place the heel of your hand in the center of their chest, directly between the nipples. Interlock the fingers of the other hand on top. With straight arms, compress the chest 5 to 6 centimeters. Compress the chest 30 times at a rate of 100 beats per minute. At this point, if you feel confident to do so, complete 2 rescue breaths. Do this by placing your hand on the top of the head, 2 fingers under the chin, and tilting the head right back. Pinch the nose and place your mouth over the abdomen. Breathe in a normal breath. Take a pause, and then breathe in a second normal breath. In between each breath, look down the chest to see the rise and fall. Breath going in. Continue CPR at a rate of 30 to 2 until one of the following 3 things happen. 1. A medical professional tells you to stop. 2. The casualty shows signs of life. Or 3. You spot with a teammate due to exhaustion. To summarise, always remember this easy formula. Doctor A, B, C. Danger,
So you have seen that, and I'm sure you have understood most of it. But remember, though we say A, B, C, the order for doing it is not actually A, B, C. The first thing that you have to do is C. As soon as you find that the person is not responding, you check the pulse at the neck. Go for the neck of the person. Find the carotid arteries, press on that side, never do it on both sides, you produce harm. You do it only on one side, try to feel the carotid pulse. All of you should be able to feel it on yourself with confidence and getting the finger placement right at the very first instant. So this is how you should know where to find the carotid pulse. And if the pulse is not present, you start compressions, and then you give some compression for some time, and then you start giving the breath. So the order is actually CAB, not ABC. You start with C, and then you continue as CAB. So it is just CAB, it goes on. You don't have to keep open the airway every time. So it is alternating between C and B. Circulation, breathing, circulation, breathing, circulation, breathing. So CAB in the beginning, and then CB, CB, CB. CB, the ratio is 30:2. I'll share my PowerPoint again. Oops. So I finished CPR. Now we go to the second one. What is the recovery position? See, there are casualties who do not require CPR. Their heart is beating, they're breathing, but they are not responding. They are seemingly unconscious. They're fainted. Now, how do you leave them? You need not wake them up. You can just call them. You need not shake them or use force or try to lift them up and lean them against a wall. These are all wrong techniques. And this is again something that I would like to tell you. When a person faints, maybe on the road, in school, on the field, inside a train, the first response from the people around is to lift him and lean him up against the nearest wall or seat. So in fact, he comes to a position where his brain is not receiving blood supply. See, we have a natural response when we faint. The body that is perpendicular to the ground becomes horizontal so that the heart can pump easily to the brain. But when you are lifting and propping up into the sitting position, you are preventing blood from flowing into the brain. So please don't do that. Let this fainted, the person who's fainted, lie on the ground flat. Even those who are feeling faint, they also should lie down flat. You should not be bothered that they're lying on the road or on the ground. There is nothing to support their head. No, these are all immaterial. The aim is to keep the body horizontal, not inclined or vertically. So never do that. Trying to prop them up into the sitting position is the wrong thing. Let them lie flat and they will recover in a couple of minutes. So when there is a person who is not requiring CPR, but is not conscious or not fully conscious, he's breathing, he's got a heartbeat, so but he cannot be left alone on his back. So we put these persons in the recovery position. That means you have to keep them on the side. Why so? Because when this person who is unconscious, who cannot swallow his own saliva, or if he vomits, he will not be able to spit it out or turn his head to the side. So there is always a danger of this vomitus flowing back into his lungs, or the saliva also because of not being swallowed goes into the lungs. This produces very severe damage to the lungs that should not happen at all. So we have to allow the saliva or the vomitus to flow out. For that, the best position is to keep the person on the side. So there is a technique. Again, I'll show you the video for this. This is the position. You find the person on his back. This is the person who doesn't require CPR. You keep one hand on your side like this, feet together, hand on the other side, and then you hold the upper limb and the lower limb like that. After bringing the opposite arm under the chin, you're trying to create a pillow for him, and then you turn him without twisting his trunk. This is very important. You do not know whether he's got a spine injury, a neck injury. If you twist the spine or the neck, you will produce damage. So this technique of putting a person into the recovery position is to be done very carefully, but without twisting the trunk. Then you will be able to safely put him into the position where wait till he recovers. The saliva will flow out, so will the vomiters in case he vomits. Or any fluid flowing out from the nose also will flow out. If it's bleeding from the nose, that will also flow out. Where can you use it? Here is a person, let's say a person who is running into the stadium after a long race. He collapses on the finish line, and then he has to recover. He's completely exhausted. Don't leave him on his back. Put him in the recovery position. So you'll find instances where a recovery position should be used elsewhere also. So now let's see this video, so it will be clearer to you. Can you see my video? Oh, okay. Sorry.
The video is not yet visible.
Yeah.
Okay, now it's started sharing.
Glasses, and then you put the objects in the pocket that do not serve the pocket for small items. Make sure both of the athlete's legs are straight. Then take the arm nearest to you and place it at a right angle to the body with the arm facing upwards, like so. Take the other arm and bend across the chest and place the back of your hand against the cheek nearest to you and hold it there. With the other hand, lift the far knee up until the foot is flat on the floor. Whilst keeping the plasmid's hand pressed against the cheek, pull on the far leg and carefully roll the plasmid towards you and onto this side, like so. Once you've done this, adjust the top leg so that it is at a right angle. Tilt the plasmid head back so that the airway remains open. If needed, adjust the hand under the cheek to help to keep the airway open. If it has not already been done, call 999 or 112 for emergency help. Keep checking the level of response until help arrives. So remember. So this is the recovery position where you are allowing the person to breathe well. He doesn't require CPR. Now back to my presentation. So recovery position is clear to you. There is a slight difference in what he has described. I do not subscribe to his technique totally. The best technique is to actually hold him, even in this picture it's not clear, you take this hand and hold it over this shoulder so that you can you can turn him without twisting his body. Now, another common problem which is not managed correctly. What is the first aid for bleeding from the nose? Very simple. Keep the person seated, pinch the nostrils closed, ask the person to lean forward, ask him to open his mouth and breathe through the mouth. Any saliva or blood that flows out, can be spat out. The mouth, the nostrils are closed, only the mouth remains open. This is the position. This is the correct position. Don't let the person lean back. Don't let the person lie back. Don't, but you can't keep him in the recovery position if he's got a head injury. Remember, when there is a head injury, the bleeding from the nose may not be from the nose itself. It could be from the head, from the brain. It's just leaking out through the nose. So when you find an unconscious person bleeding from the nose, this is not the first aid. This is the first aid for a person who is conscious, responsive, who can follow your commands. This is due to some problem in the nose, maybe due to injury, or maybe in children, you can just bleeding all of a sudden without any cause. But in contact sports, there could be an impact, and there can be bleeding from the nose. And then you shouldn't be keeping the person leaning back. So lean forward, close the nostrils, open the mouth, and breathe through the mouth, spit out through the mouth, whatever it comes, whether it's saliva or blood. It usually settles within 3-4 minutes. You can try for a maximum of 10 minutes. You can repeat it if it is bleeding. But if you find it's continuing to bleed in spite of multiple attempts of stopping it, this person has to go to hospital immediately. Or else the bleeding will be stopped on the field side itself, and then later you can go to the hospital. But if you think it is still continuing and it is not, the bleeding is not stopped, you can go to the hospital, or you can take him to the hospital with him holding the nostrils closed and breathing through the mouth. Nothing will happen to, no danger will come on him. You can be comfortably driving this person to, if you are taking him in his car, in your car, you can drive without concentrating on that person's condition. So he'll be safe. Now, near drowning, again, this is a situation which is, of course, not very common, but God forbid, if such a situation arises, what should be done? So these are the do's, and the other side you find the don'ts. And the do's, you see, there are two options. One is the person who has been saved from drowning has a heartbeat. He's breathing. Put him in the recovery position and shift to hospital. So here is the use of the recovery position. Shift him in the car, you put him on the back seat in the recovery position. If the ambulance comes with the ambulance crew, they also do this, administering oxygen at the same time. But if the person doesn't seem to be having the pulse, the heart beating or breathing, should receive CPR. There are only two things, one of two things to be done, either the first one or the second. Many people try this. They try to press the abdomen to bring out water that has been. Just let me take this call. Sorry, that's part of my work. I couldn't postpone that. Okay. So see, don't try to press the abdomen to bring out water that has been swallowed. It will not come out. The lung is not a vessel which can be filled with either with air or with water. The lung will just absorb the water that goes in it. Even if you press or invert him, the water will not come out. All that you do is to give CPR or put them in the recovery position. Same time, transporting the person to the hospital. So this is the only right method of responding to a near drowning situation. Now, fits can happen even in sports people, and some people get afraid seeing fits. Don't be afraid. It's a phenomenon of increased electrical activity in the brain, and that's nothing to be scared about. But there are so many myths about what is to be done when a person is having fits. Some people give metal keys for them to grip. Some people put metal objects like keys between the teeth so that they bite on that. All this is wrong. Not only are they wrong, they are harmful to the person. You produce injuries. You may allow the person's teeth to be damaged. Sometimes the person can bite on you with the attempt. You can get injured on your fingers. Do nothing. Just leave the person, put him in the recovery position. Look at this graphic. See, turn the person to the recovery position. Having fits is not dangerous provided he is breathing. If his breathing is affected, he requests help. Usually it settles in 3-4 minutes. Put him in the recovery position. Turn him to the side for the recovery position, and the saliva will flow out. He should be breathing, and tilt the head back a little, and then he should be breathing comfortably. And then you can take him to hospital if the fits are not settling. Usually he'll wake up within 5-6 minutes. Sometimes a little prolonged, about 15 minutes. Remember, when a person is having fits, the person is unconscious. He will not remember anything that happens during the period. Don't talk to him. Don't give him, try to pour anything into his mouth. Don't put anything into his, any metal object between his fingers or into the mouth. Recovery position, only recovery position. Head injuries, again, a major portion of first aid. See, scalp injuries, very gory. It looks, I think, scary for some people. Scalp injuries are usually harmless except for the bleeding. No serious harm will come to the person unless it's a child who is losing a lot of blood. But it is not at all very, I think, comfortable to see somebody walking up from the field with a bloody head and a bloody face. The bleeding is, of course, very profuse, and children can lose a lot of blood. But remember, this hit could have damaged the skull. It could have fractured the skull. It could have damaged the brain inside, which will be evident only later. So what should be done? You should not allow this person to play immediately. He requires care. What do you do? What do you do with all this messy face and hair? The bleeding seemingly has stopped. See, this is very important. Never wash a scalp wound. Don't try to make him look better. Don't try to make him presentable. By washing his face and head with water, you might allow an underlying fracture to leak, for the water to leak through the underlying fracture into the brain. Very dangerous. Do not try to clean the wound. Do not pull out dirt from the wound. It will all be done in the hospital. Whereas a wound on the hand or on the leg, you can easily wash with under the tap. Absolutely no harm will come. But never do that with the scalp injury. By pressing over the wound, you can control bleeding, and you can wrap a roller bandage. That means you go round and round with the bandage, with that gauze pad. You keep rolling around with the roller bandage. And if you think it is a serious injury, the person is unconscious, his neck has to be stabilized while shifting him, and the procedure will follow very soon. Now, when you come to the injuries to the brain, there are 3 major injuries. One is concussion. Second is fractures of the skull. And thirdly, bleeding inside the skull, which is the most serious of these 3. Now, concussion, a typical example, what happens in boxing. A knockout is a concussion. It happens to minor levels, minor degrees in almost every punch, that is landing appropriately, or in sometimes collision in football. The concussion is a temporary reduction. You find 2 people colliding, you can hear the sound of their skulls colliding, and then one of them looks quite dazed. He walks around a little unsteady as if he's drunk. Here is a case of concussion, because the brain is very soft and it will shake inside the hard skull and it will damage itself. So the skull is damaging what it is trying to protect. So the brain is damaged by the shake, and it will take some days for it to recover. Concussion doesn't recover instantly. And there is severity of the grading of the concussion depending on how much of time this person remains unconscious and what all things he has lost in terms of his brain function. So as I told you, a knockout is the typical concussion, and the person should be waking up before the count of 8, so that he'll be able to fit to fight. Otherwise, the referee rules that his concussion is that bad, he cannot take a punch any longer, and then he'll be that round goes to the other person. In fact, not the round, the match goes to the other person. So that's a knockout. So knockouts have happened for many, many years in boxing, but now it is because of the protection and because of the rules, it is rarer, but small amounts of concussion, which all accrue the damage to the skull, to the brain rather. And what are the symptoms of concussion? One thing is unconsciousness. Not everybody becomes unconscious, but when they wake, some of them, when they wake up or when they get up from the collision from the ground, they're confused. They do not know what has happened. They are dizzy. They are unsteady. They've got a bad headache, which keeps worsening for the first 2-3 days. The vision is blurred. They have forgotten many things, including why they have come to the ground, which ground they are playing in. This will all happen if the concussion is not very mild. They will forget why. He will forget what has happened. He will forget how the collision occurred. Secondly, he will forget why he has been playing on that ground. He will ask his friends, why are we here? Where are we? Which college is this? Which ground is this? So this is all concussion, which shows you that the brain has been shaken pretty badly and it will take time to recover. But remember, when the brain is shaken like that, you cannot shake the brain and they shake the brain and get away with it. The brain will object to this insult by getting swelling. Just like the ankle swelling up after a sprain, the brain will also swell up, and it is dangerous. And the headache will increase, and there are other symptoms. So other problems, may not be a simple shaking that has happened. There can be bleeding within the skull due to damage on the brain or damage of the coverings of the brain. And here is a condition where you cannot do anything to prevent bleeding inside. It's absolutely invisible. It is internal. So what do? Just keep him in the recovery position. Check the ABCs. So see, recovery position is very, very important. CPR, if it is a condition which has knocked a person unconscious and without a heartbeat and not breathing, the person is as good as dead if you don't give him CPR. So bleeding within the skull needs to be operated upon and the blood removed in most instances. It's a very serious condition. Rush him to hospital. But concussions, because they are seemingly very mild, may not be taken to hospital. The person may not even reveal to you if he has not been playing under your supervision. So when you find a person and you get a report that there has been a person with head injury and you cannot take him to a hospital, this person must not be left alone. He needs to be observed. He cannot be allowed to go and lock himself in the room and sleep overnight and then come in the early morning for the next day's training. No, he will have sometimes problems in the night. He may become unconscious. He may start vomiting. He may get fits. He may have more headache. So these are all showing worsening of the damage inside the brain. He has to be rushed to hospital in case you have not taken him to the hospital initially. So this is for what cases have been missed. Even when a person with a head injury is taken to hospital, they will not, even if they don't find anything wrong with him, he will be asked to stay back in the hospital at least for a day, so that they can also observe any damage that is coming up within this period. But also, some of them come back after a concussion. They come to the ground 2-3 days later, and then they say they got a headache. Otherwise, they are okay. Would you let them play? The answer is no. It is a categorical no. You cannot let them play if they got headache, if they are feeling dizzy, they are unsteady in the gait, they have loss of memory. That means the brain has not recovered. This person should not be allowed to play. Even the running, the jogging, the shaking that happens during jogging can produce more swelling in the brain and make the person's medical condition worse. So the person can return after a concussion only if this person does not have any of these symptoms: headache, feeling dizziness, loss of balance, loss of memory. And spine injuries. Again, this is a very important section because you can prevent a lot of damage developing that usually happens during transport. See, the spinal cord, you seen in yellow color, is protected by the bones known as the vertebral column. It is actually sitting inside a canal in that. But when it is broken, when it is fractured, when the ligaments are torn, these individual pieces of bones or the broken pieces of bones can damage the spinal cord that is present inside that canal, which means that when a person who is already injured is not transported properly or lifted in a very awkward manner or twisted while doing first aid, can get secondary damage, which could have been prevented in the first place if the first aider was a properly trained person. Now, injuries of the spine are usually, luckily, very rare. There are lots of small back injuries that occur. They do not damage the spinal cord. But when this damage occurs in very severe accidents, it can be potentially risky for the person to be handled by a person who doesn't know first aid. So all spinal injuries must be treated with care. They should be handled in such a way that their spinal cord is not allowed to move. The spinal column is not allowed to move or twist, and they are safely transported to hospital. This is the aim of the first aider. So before you turn them from the position where you find them, here you find the person lying face down, you must make the assessment on the ground in the position that you find the person. You should not turn him to check whether he's breathing or not. You can check it while he is there. You can check his pulse in this position. You can check his response in this position. So do not turn him unnecessarily and create a situation where his original injury has worsened. So the primary survey, as in the beginning, this is very important. Look at airway, breathing and circulation. That is a life-saving procedure when you administer CPR. And also, you must be careful not to injure his neck while you do the extension of the neck. So once this primary survey is over, you have to look for these symptoms which will warn you that this person has got a neck or back injury, the spinal injuries. The person can be unconscious. If you find an unconscious person, you should be assuming that this person also has a spinal injury. There can be weakness and paralysis. If the person is conscious, he will say he cannot move an arm or leg. He'll be feeling numb or having a funny tingling sensation running down his arms and legs. He'll complain of pain along the back, pain along the neck. He'll be having breathing difficulty. And sometimes you can find very gross, obvious deformity of the spine. An associated head injury or neck injury will all tell you that the rest of the spinal column could also be damaged. So what can be done? What is the first aid? They had to be very, very carefully handled. You can handle them as we are holding a baby. So maintain the airway. CPR, if required, yes. You cannot do CPR in the face down position. You have to turn them onto the supine position. So what should you do? You turn the person with help by log roll, the technique that you learned soon, by log rolling onto his back and then giving CPR without damaging his spine. So that is a standard procedure for shifting the patient with a spinal injury or any critically injured person to hospital. So that you learn after this. So first aid for chest and abdomen. Now, our chest and abdomen contains so many vital organs which can be damaged. In the chest, you have the heart, the lungs. In the abdomen, you have the liver, the spleen, the kidneys, urinary bladder, intestines, stomach. But these injuries always may not be obvious because these are internal injuries. The bleeding, the damage is internal. Unless you do some investigation like a scan or a doctor examines, or when you open up during surgery, only then you can see this damage. So a person on the field the first aider will not be able to really figure out whether this person's internal organs are injured or not. So first we must know what is the difference between a closed injury and an open injury. A closed injury is one where there has been a compression or a crush on the chest or the abdomen with absolutely no wound on the skin. That there is no external injury. All the injury has happened, all of this injury has happened in the cavity, chest or abdomen. Whereas open injuries, it can occur from outside. That means he has been hit by something that has penetrated his skin, then it has penetrated his what do you call, chest wall, and entered his thorax. So now here is a picture that has happened in an international competition where a long jumper was struck by a javelin, a wavered javelin. You can see this javelin here stuck into his chest. Unimaginable, but it has happened in an international event. So it can occur anywhere, anytime. And this open injury, luckily he survived. It could have been dangerous had this javelin entered the thorax, the chest, a little deeper. So closed injuries, no wounds. Open injuries, external wounds. And first aid, what should be done? Again, this is a very serious injury. There is no first aid for all this. You can't do anything to control the internal bleeding, but you can help the doctors by not doing something. What is it? Of course, you can keep an open airway and allow him to have a normal breathing. That means you're preventing the deterioration of his medical condition. And you provide emotional support to keep the person at rest. He'll be very anxious, upset, suffering pain. You give him the support that he requires. Loose and tight clothes. And do not give anything to eat or drink. This is very important because this person will most often require an operation. And if you're taken something to eat or taken something to drink, you will not be operated upon until this food or drink leaves the stomach. So we have to wait 2-3 hours. And that is why for major surgeries where the general anesthesia is administered, the patient is asked to fast overnight. We have experienced that. I've seen happening that to relatives. For a proper anesthesia to be given safely, the stomach has to be empty. So if you unnecessarily make them drink a lot of whatever, anything other than water, or give them something to eat, you are only delaying the surgery. So this is how a first aider can help the doctors give faster treatment. And until the doctor says it's okay, he doesn't have any injury, so give him something to eat or drink, you shouldn't be doing it. If he says he's very thirsty, you can give him spoonfuls of water, so sips of water. That can be absorbed very fast, not gulps of water. And when there are fractures, they can be splinted, but if you don't know how to splint it, leave it. Splinting is not being done of late, because if you don't do it properly, you can produce more shifting of the bones, more pain, more damage. Rather shift him as easily as possible on a stretcher. Now, this is a very common injury. Known as a solar plexus injury, getting a kick in this area marked by this red circle, or getting punched, which kind of immobilizes the person who receives the punch. He doubles up due to that hit. He cannot breathe. He panics. He thinks that he's going to die. This is a solar plexus injury. What is the solar plexus? It is a collection of nerves inside the abdomen, somewhere around here, upper abdomen. And it is a very sensitive area. Those who have received a punch there, those who have got a kick while playing, or those who have got a very powerful hit of the ball on that area would definitely tell you, or will know that this is a very painful, very difficult injury to suffer. But it's usually harmless. The person recovers within few minutes. But this period of recovery is marked by a very high anxiety state of the athlete. Person feels that he or she is going to die. He'll be struggling to take a breath. So how do you try to help him? Because he within 2 minutes he will not be able to reach a hospital. So you can, during this 2-3 minutes, you can help him by doing a couple of things. Loosen the tight clothing around the chest and abdomen. Secondly, teach him how to breathe with a special pattern. Short inspirations, gasps of inspiration, and a prolonged expiration. The inspiratory phase is very short and the expiration is prolonged. This is how you help the person to come out of that very quickly. Usually it disappears in 5-10 minutes. If the person is not recovering, the person should be shifted to hospital. In the ambulance or the car, he can continue to try these techniques, but do not keep the athlete at your center without taking to hospital, trying on this first aid pattern for half an hour. No, this is maybe 5 to 10 minutes. That's all till the car arrives, because the same hit that produces a solar plexus injury could produce an internal organ damage also. You won't know. It all, the area of hit is the same. It depends on the severity of the punch or the kick, what structures got injured. In a solar plexus injury, there is no injury that can be seen. It is a kind of a shock on the nerves, which will recover after 5-10 minutes. Now, first aid for neck injuries. Neck is a very important part of the body because it has the spinal cord which carries the nerves for the rest of the body. This portion, you can see, this portion, which is what we call as the neck, has a very thin spinal column covering that will not allow much of twisting or bending. It will break. Now, when the neck is injured, what are the structures that are injured? One is, if it is an injury from the front, the airway can be injured. Then behind that, there are on the side the arteries and the veins, big ones like the carotid artery. There's a vein that comes down known as the jugular vein, and at the back you have the spinal cord. Any of these structures can be injured. And see, airway injury, for example, getting a kick or a punch onto your throat or to your windpipe. This seems to be a very minor injury. No, these are, of course, when you get an injury without an external wound, it's known as closed injuries. If there is a wound, we call it as an open injury. A closed injury to this part may not seem to be a severe injury. That is wrong, because this is an airway. The swelling of the airway inside can block the what do you call this, the windpipe or your voice box. So why does this happen? This happens because the swelling develops to the injured area, and the swelling may not happen instantaneously. The swelling may develop over a couple of hours, and the person's voice starts changing. Then you know this person has got swelling. So don't wait until voice change happens. A person who gets a kick or a hard hit on the front of the neck should go to the hospital. They can see the throat through the mouth with special equipment, so that they'll be able to visualize it much before the symptoms develop. So, but remember, a person who has had a hit on the neck, front or side, having a change of voice, its voice becomes hoarse, is getting into a serious problem. You cannot keep him in the hostel or elsewhere. The person should be in the hospital. There is no other first aid that can be given, because opening the airway by lifting the neck to the head will not remove the swelling here. So the ABC will not work here. So the person has to be in the hospital. So other injuries, the blood vessel injuries on the neck, beg your pardon, blood vessel injuries cannot be managed on the field. It's a very serious injury. They'll die on the way to hospital. And spinal cord injuries, I'll tell you towards the end of this presentation how to manage. Now, heat illness. India is mostly a country with a lot of tropical climate, and so is Goa. And heat illness is a possibility almost everywhere in the country except for the very northern states. And what to do for that? So you must remember that the heat of the body is a balance between heat gain and heat loss. We gain heat from the sun. When we gain heat because of muscular activity, we gain heat because of the hormones, because of the cellular activity in the cells. Heat is produced. Similarly, heat is dissipated, dispersed from the body by evaporation of the sweat, by other methods like conduction, convection, radiation. But the last one, evaporation, is the most important method of removing body heat. So when this doesn't happen, that's why people sweat. When the sweat evaporates due to the wind, due to running, the wind will come and evaporate. You sit inside a room, you start sweating, you switch on the fan or the air conditioner. The fan will carry away the heat because the sweat will evaporate. But when this doesn't happen, or when the person is participating on a hot day in a very long endurance event, he is likely to go in for heat illness. There are 3 types of heat illness that you should all be knowing. The minor one, the mildest one, is heat cramps, a very common problem. Participating in heat on a hot day, running in the heat, would definitely bring on heat cramps if there are multiple repetitions of the skill or a long distance event. And the cramps can be relieved by stretching, as all of you know, but the cramps will keep on returning unless you replace the water that is lost, also the salt that is lost. In salt, in the sense of sodium and potassium plus water, must be replaced. Plus, you must reduce the body heat. That means a person having repeated cramps should go off from the field, from direct sunlight, and sit in the shade or sit under the fan in a room. And this is where his body will cool. Otherwise, his body is not going to cool and you'll get repeated cramps. Other 2 conditions are major heat illnesses. So the heat illness, one is heat exhaustion and heat stroke. Heat stroke is very dangerous, can lead to death of the person. When there is a complete breakdown of the temperature control mechanism, the body cannot control heat anymore. It becomes like a furnace, like a boiler. It keeps on heating up and the internal organs get damaged and the person starts behaving abnormally, cannot even think properly. And these people will die if they do not get medical care and if the competition is not stopped there. I mean, his participation is not stopped. It happens in very long events, endurance events like marathon or maybe let's say Tour de France. Heat stroke. A lesser one is heat exhaustion. That is very commonly found in most of these long distance runners after a tough marathon. Most of them, on the next day, you'll find that they are feeling very tired. They cannot eat. They don't have an appetite. They feel like vomiting. When they get up from bed, they are feeling dizzy because of the fall in blood pressure. Then they think they are absolutely sick. This is heat exhaustion. The body is exhausted by the heat, and there are metabolic changes. And so this person has to rest for 2-3 days, take enough of salt and water, electrolytes, that is ORS, oral rehydration solution, available in every medical shop, very cheap, 5 rupees for a packet that makes 1 liter ORS. The same one that is used for diarrhea and vomiting in children. Stock it in your training center. It is very useful. It returns the electrolytes that is lost in sweat, and you just add water, and the water replaces the water that is lost. And let him rest in the shade in the room. He should not rest outside. Heat stroke definitely cannot be managed, but whatever be it, there is only one type of first aid for heat illness, and this is that. You have to make the heat in the body to spread to the environment. So how will you do that? You artificially create evaporation. How can you do that? You moisten the skin, paint the skin with water, and point a fan onto the skin. You know how when you wash your face and stand under a fan, you feel so cool, because when the water evaporates, you feel the body is cool. So instead of the body's sweat coming out and producing that film of water, film of liquid, you add water. You can even give him a bath, pour water on his body, and this water will evaporate and absorb heat and cool the body. Similarly, you can, if the person is conscious, give fluids with ORS to drink, keep the feet elevated so that more blood flows towards the brain. And in some areas like the groin or the axilla, you can give cold compresses. That means towels with ice inside or towels kept in the freezer. So in certain areas like the axillae or in the groin, you can keep this. And first aid for bleeding. Okay, I've taken 1 hour, 15 minutes. I think I'll speed up. First aid for bleeding. The bleeding, see, bleeding can be minor bleeding or severe bleeding. But for minor bleeding, it's very simple. You apply pressure over the wound. But the most important thing in this picture is the glove that the person is wearing. Do not get any fluid or blood, that athlete's blood, onto your hands. You must be careful not to get any illness like AIDS or hepatitis from the athlete. If you are not careful, this is that what I said in the beginning. The second important principle is protect yourself. Do not try to stop bleeding by pressing with your bare hands. If you don't have gloves available, you should be using a thick cloth. You can even use the tracksuit of the athlete to press so that the blood doesn't reach your bare skin. And the second, if it is little more, then you not only do you apply pressure, you elevate the limb so that gravity will pull the blood down away from the bleeding area and the bleeding will stop faster. But if it's a very severe bleeding, quite rare in sports, it can happen in road traffic accidents or in war wounds, where there is a severe bleeding from very bad injuries in the limbs. Then if it is in the upper limb, you can cut off the blood supply to the whole upper limb by pressing on a major artery here in the inside of the upper arm. This is, if you press hard on this area, you can decrease or even stop the blood supply to the lower part, and then secondarily apply pressure on the bleeding area so to stop the bleeding. Similarly, in the groin, in the crease that marks the boundary between the thigh and the lower abdomen, you have a crease in the groin, and that at the midpoint of that crease, you kneel down and use your body weight to press down on that area. You can stop the bleeding, stop the blood flow to the lower limb, and produce control of the severe bleeding until help arrives or the person reaches hospital. Remember, this is first aid. This is not for hours of pressing. This is until the person reaches hospital. If you know these 2 points, one is here, the other is the crease of the groin. You press on the midpoint of the crease. On each side, you draw the diagonal, find the midpoint for each side. Then you press hard, and then you can stop the bleeding. Then first aid for musculoskeletal injuries. This you encounter almost every day, and these are these are harmless injuries, but they can affect the career of the sports career of the athlete. So please remember, this could be life-changing injuries that are happening on the field. So for all muscular injuries, ligament injuries, tendon injuries, or ligament injuries, you can use this acronym RICE, rest, ice, compression, elevation. I am sure you practice that. But this is very easy to do. But some coaches or some teachers go beyond this. For example, if there is a dislocation, should you try to reduce the dislocation on the field? The answer is no, a categorical no. You should not do it. You can produce a lot of damage by putting back joint as you think is right. It can be done only by trained people or after seeing the kind of damage. See, you don't even know whether there is a fracture along with that. Some people will put it back and fracture the arm again. I have seen children sports careers being hampered, being affected badly by coaches who are over enthusiastic in doing this. No coach or teacher is supposed to do this. You should not reduce a dislocation or try to put a fracture, align a fracture, or set a fracture. This has to be done after appropriate checkup with x-rays, then only should be done. So what is to be done? Nothing is to be done. you should prevent further movement of the fractured area or the dislocated area, support the area, and shift the person to hospital. For God's sake, do not try to reduce the dislocation. Now, this is a very important point. Transportation, we are coming to the end of the lecture. We're almost through with this. And transportation of a critically injured athlete. See, head and spine injuries go together, and most serious injuries will have injuries to the spine. So, this is an incident that happened in Kerala last year. A person who was volunteering for a sports meet was struck by a wayward hammer. Poor boy who was running to take something else from the ground. A volunteer, one of the school students who was volunteering, was struck by a hammer. Struck on the head by a hammer, and this is the response. Look at the response. Look at the first aid for the major state event, and look at how the boy has been carried. Is this right? No, this is absolutely wrong. This boy unfortunately did not make it. He passed away in hospital a couple of days. He had a severe head injury, and if you have, this boy has also got a spine injury. What could happen, or what would happen if this person is carried like this? So please do not do this. Please wait for the ambulance. Even if the person is on the field for another 10 minutes, it's not going to make a difference. If you try to take him in a car like this, or if you try without a stretcher, you carry him into the ambulance like this, you are permanently damaging his spinal cord. It should never be done. You should follow only the technique that I am telling you. So the person is to be transported using a log roll technique. And I'll show you the video after this description. See, the body has to be turned as if you're turning a log of wood. You should not twist it. The same way that the body was turned for putting the person in the recovery position. See, the person is lying flat on the ground, or has been turned to lie flat. There is something here known as the spine board. There is a captain of the team who stabilizes the head and the neck, and at 3 members, or at least 2, on the same side, holding the person, shoulder, trunk, hip, and legs. And the captain gives the command, and on the command, they all turn the person to the side simultaneously. See, place the spine board under the body, under the athlete, and turn back again. During this movement, neither was the neck nor the rest of the spine twisted or bent. This athlete was turned as if this is not a person, it is only a log of wood. That is why it is called as a log roll technique. You've seen in all these timber industries how the big logs are transported by rolling. So this rolling, this is called as the log roll technique. We need not go into that technique. And when you see the video, you will understand how it is done. So I'll share my screen again with the video. It's of course an amateur video. The trainees who are doing it may not be accurate, but I'll tell you what is wrong. See, this is an amateurish attempt. This is an amateurish attempt, and see, this blind board has not been placed appropriately, but it's okay. They are learning. There should not be any twisting. Here they are actually not synchronized. The timing is not very good, but See, you must know that the spine injuries are very painful. The person will not tolerate any amount of twisting or bending. The person would be screaming. Not only that, not just the pain, any shifting of the spinal cord inside the broken bones can damage it further. So they have to lower it, and preferably the placement should be in such a way that the person rolls toward the center of the board instead of being again lifted and pushed to the middle of the board. Now, that's it. That is the log roll technique. Very easy thing to do. Only thing that is required is the coordination of the two members, and the captain should ensure coordination. So anybody, any team can practice it. And now come to the last slide, or the last two. We're almost through with it. Finally, first aid box. There is a mandatory requirement of first aid boxes in many places. So I thought I should tell you what should be the ideal first aid box. In the next slide, I'm going to show you a picture of an ideal first aid box. This is the first aid box. What I'm trying to tell you, the first aid is in our mind, in our brain. It is not the equipment that will help you, that you keep in on the training areas. The decision to do what is right after a proper evaluation, this should be your first aid box. The rest of the things are actually for minor problems. The major first aid measures are taken not by using what is in the bag, but by thinking, acting properly when you're trained. And this is the most important one when you have a first aid kit, is to protect yourself. Use appropriate gloves so that you are not contaminating your hand. And also, when you're using sterile gloves, you are protecting the person also from infection. Protecting the person also from infection. Sterile gauze. Every training center should store sterile gauze. That is easily available now in all medical shops, surgical shops, as ready-made ones, sterilized and sealed. A little expensive, but it is good to stock these in your department, in your stadium, or even in your personal first aid kit. Have bandages to tie all this up, scissors, adhesive tape. Now, even though it looks very minor, it serves a very important purpose. When you cover a bleeding area with an appropriate bandage and then stick it up, you are preventing the blood from contaminating other people. Remember, when you take off your gloves, you find somebody who is having a soaked bandage and you touch it, you are now touching blood with your bare hands. So the bandage and dressing not only protects the individual from getting infection in the wound, but also protects others by preventing contact of this person's blood with another person's skin. This is very important nowadays. There are diseases like AIDS, which cannot be even now be treated completely effectively. So always be safe. So I conclude by reminding you of the two important principles of first aid. Primum non nocere. Primarily, do no harm. And secondly, protect yourself adequately and then do the first aid. With this, I am now stopping this screen sharing. I stop my presentation here. And now I request Steffi ma'am to take over. And please.
Yes, sir. Indeed, it was a very wonderful session, very informative, and I think this is something which is the most important where coaching is concerned. But I think the most neglected part, in terms of emergency, sometimes we really don't know how to kind of what is to be done. So I think your session was a great session, sir, and lots to learn from this. And we'll just take a few questions, sir, a few question and answers, if you could.
Yes.
So I'll start with with the first one. Um, Whenever an athlete or a player gets injured on the field, there is there is a kind of a confusion sometimes whether we need to first apply ice or first apply heat or massage the part, or even during the course of recovery 2-3 days after getting injured, what exactly is recommended? Because I myself have a confusion sometimes, not knowing whether heat or cold or combination or massage, or so how exactly, especially when a sprain or a fracture happens.
Yeah.
So doctor, what exactly do you advise, what goes first?
Thank you for your question. See, the answer is very simple. It is RICE, rest, ice, compression, and elevation. Ice is supposed to reduce the bleeding because ice makes the blood vessels to constrict. The diameter decreases and the bleeding into the area decreases, swelling decreases, the pain decreases, and as a whole makes the the person feel better. So it must be ice, ice, ice alone. If you give heat during the immediate post-injury period, the blood vessels will open up. That means it will increase the bleeding. It will increase the swelling. It will increase because of the swelling and the increased pain, the increased bleeding. It will produce more pain. It also now leads to a delayed recovery. So when you apply ice for the first 48 to 72 hours, you are opening the road to a quick recovery. And after 48 to 72 hours, that means after the third day, you can start giving heat. So the first 72 hours, it must be ice alone. And no massage, because massage will produce more bleeding. Massage, if at all, should be done, it should be done after the first 2 weeks. Otherwise, you are damaging the area and producing more bleeding inside. The body is trying to patch up the injured tissue, and if you irritate it from outside, it will bleed again. So just leave it alone, and it will heal on its own. And then to help the healing and to improve the flexibility, you can try massage. So it's ice without massage the first 2-3 days.
So this is Nilesh.
Great, thank you. Nilesh can take the second question.
Yeah. So this is one question for you. So which test should we use if you suspect that a casualty has had a stroke or a fits? Most probably for stroke. Yeah.
No, in fact, there is no test by which you can decide on the field as a first aider whether it is a stroke or it's just another type of fit. See, there are some types of stroke where it presents as fits. Fits only mean that there is some abdominal electrical activity that is going on inside the brain. It could be due to the fit that is found in people who have epilepsy, due to a focus in the brain which keeps on firing once in a while. It's like an old car that misfires often. The stroke itself will sometimes produce this misfiring because it damages certain areas where electrical activity occurs, and that will produce fits. So you will not be able to differentiate. The only thing I'd like to tell you is, if the person is having fits, give the first aid for fits. And that is very simple. Put the person on his side into the recovery position, wait for the fits to settle, and then shift him to the hospital. If the fits are not settling, even after 15-20 minutes, you have to hurry up with the shifting. Usually he's having more serious problem. Usually most of the fits will settle within about 2-3 minutes, and then in another 3-4 minutes, you will wake up.
Thank you,
fits,
sir.
yeah. Thank you.
Thank you.
So, in addition to this, is there any permanent cure for fits? For this the problem of fits, is there any permanent cure or any permanent treatment or
Yes.
recovery from this?
Yes, of course. Now there are modern techniques where you can localize these areas in the brain by the modern imaging techniques, modern electrical diagnostic techniques, and then try, sometimes, not always, try to neutralize this electrical activity focus. But it is not very common, because even otherwise there are very good medications available that can control fits. So this kind of electrical surgical treatment is not required. With medicines, you can control it very effectively, and the person will be able to participate in sport even after taking the medicines. No issues. These are not doping drugs usually.
Wait, don't. Okay, sir. Just another question. There's a myth that if you leave an adhesive bandage on, it enables faster healing. So is that true?
See, the
Leaving a
primary
bandage on for a longer period of time.
No, it depends on the size of the wound, and secondly, the amount of fluid that flows out of the wound. See, the bandage serves two purposes. One is to protect this wound from the outside, to prevent infection. Secondly, it absorbs and collects all the secretions, the pus, everything that comes from the wound. So if there is no outpouring from the wound, that means the wound is dry rather than wet and oozy. If there is no outpouring, and if there is no danger of infection to others, the wound can be left open because exposure to atmospheric air will help in healing. If you keep it always bandaged, unless it is an indication because of the secretions, if you always keep it bandaged, you may prolong it because it will get wet inside, and then it will get a bit macerated, soft, and very fragile. So a general rule, a statement is difficult, but if it is a dry wound, it has dried up, there is no more secretion, then you can leave it open.
Nilesh, unmute yourself. Nilesh, you need to unmute yourself.
Of sodium or pigment.
I'm sorry, I didn't hear the first part of your question. I heard it only from the sodium.
Yeah, what kind of sodium or potassium supplements are recommended for the heat illness?
For heat illness?
Yeah, what kind of sodium or supplements?
There is only one kind of sodium, that is sodium chloride. So that is either taken as salt in our diet, or sodium can be part of the oral rehydration solutions, ORS packets, which are appropriately proportioned. Sugar plus sodium plus potassium. You just have to buy ORS packets, very cheap, less than 5 rupees per packet for one, that will reconstitute as 1 liter. And then athletes can stock it in their kit bags that can be taken even if there is no heat illness, or even if there is heat illness. It is a drink that is harmless and is very beneficial. For recovery also they can use after training period. But they should not add more salt into that already prepared combination of sugar, sodium, potassium.
Okay, sir, I have another very simple question.
Please.
But sometimes at the time when you're on the site of an accident or an incident, untoward incident, this can be a little confusing. So I want to know, if you're alone at a scene, alone at a place, and you have a casualty in front of you, someone's injured, what should you do first? Call emergency, call the ambulance, or provide first aid to the person who is in need?
In fact, you should do both. That means you should be calling somebody before you step into the first aid procedure. That means if your hands are full, like you are already started the CPR, you cannot stop it and then call the ambulance. So while you are doing the assessment, you are alone, you have to do a primary survey where you're looking at whether the person is responsive, whether the person can speak, whether the person is conscious. So you spend some time, few seconds you're spending, use that time while you're speaking to the person to feel the pulse on the neck or check his breathing. So you do multiple things within 10-15 seconds. So you get an idea of what is the position in which he is, whether he's having a lack of response to your calls or even taps on the shoulder. That means his person is unconscious, and then you have to know whether it is a heartbeat and a breathing pattern. So the priority is to restore the heartbeat, so you can leave the respiration away alone and start pumping the chest. to get the heart beating again. And at the same, you would have given a call, or you can what do you call out to somebody. If somebody is at hearing distance, then they will come rushing in and help you. Otherwise, you have to call an ambulance or whatever the number that you've got. We call a friend, anybody. But don't delay CPR beyond 10-15 seconds. This is the time you must take about 15 seconds to assess whether the person's heart is beating.
Okay, Nilesh, do you wish to ask
Steffi,
a question?
I have the last question. Sir, any special first aid for lower back pain?
In fact, lower back pain is just a symptom. It's a pain. I can't offer any first aid advice for that, because if you look at the causes of back pain, there are about 100 causes that you can list down if you ask a doctor of why back pain occurs. So this back pain, obviously, in many cases due to an injury, could be due to injury to many of the areas that are covered with the skin. Inside there are so many ligaments, tiny bone parts, many muscles, spinal cord, nerves. So it could be due to from any of the discs in the spine. So as a first aid, there's only one thing I can now think about, that is rest. Stop the game, then let him rest, and then we can decide the intensity of the pain. Ice may not be useful, because if it is from deep inside, the pain, if it is coming from deep inside, the deeper structures will not be affected by the ice that is applied onto the back, because it is so thick, those portions. And it is too early for heat to be applied. So stop moving, and the pain intensity might change. So that is, rest is what I would suggest as a general statement for back pain.
Okay, so I think we'll take the last question of today's program. It was really wonderful, very mind-opening, and just to have so much knowledge on something that is usually not given that much importance. So the last question for today's program is, sir, many people believe in home remedies like maybe turmeric, or applying butter to burns. On open cuts and wounds, people would apply things like turmeric, or some homemade remedies. So is that advisable, or how safe is it to use those kind of things instead of adhering to proper first aid being given for that injury, like in open cuts and wounds, especially at home? People just apply various items available. So what do you have to say about that, sir?
See, for burns, the best first aid is washing with clean water. Don't put anything, no antiseptic, no soap, no oil. Oil, you cannot wash away oil. Very difficult to wash away with. If you apply butter to this burnt area, you go to the hospital, how do they get the butter off from that wound? See, oil is supposed to be waterproof, right? Oil rejects or repels water. And none of this washing will help to clean the wound if you have applied oil. So applying oil, butter, ghee is wrong. Water. Clean it in running water. That is the best thing that you can do, because we have to remove as much of dead particles, or germs, and remnants of clothes, of the cloth, whatever was covering there, fiber, whatnot. And the best thing is water, cool water. But don't apply ice. Ice will damage the skin that is already damaged by heat. So I don't support all these home remedies for burns. There are home remedies probably which are good for other things, but for this oil, butter, ghee, some have seen some people applying pig fat. This is not like, it's not the source of the fat that is important. It is that it is an oil, a fat that will repel water and will prevent cleaning of the wound and seal in, and also prevents a coating for the infection. So it will take time to heal, or it will bring in more infection. So that is about burns. So the best thing is water. If you wash it with water, there is no harm that you'll be doing. In fact, you're helping the doctors to clean it better. And it also reduces pain to some extent.
Okay, thank you so much, sir. Before I request our coach, Yogesh Saval Desai, to propose the vote of thanks, I would just like to make an announcement requesting all the participants attending today's program on YouTube and Zoom. A link is provided in the chat box. So you need to click the link, you need to feed it, fill in the feedback form and submit. Please do not share the link with any other non-attending participant. So please do that. The link is open for another 1 hour. So please submit your feedback forms. And within 10 days after verification, your certificate will be emailed to you. So I now request, but on behalf of the SAG, sir, first, before the vote of thanks is proposed by Yogesh, I would like to thank you for your valuable time and accepting our invite today. But officially, Yogesh Savudesa will now propose the vote of thanks.
Hello.
Yes, Prasad, you're audible. You can go ahead.
Yeah, I'm Yogesh. Hello.
Oh, sorry,
very,
Yogesh Savudesa, yes.
Okay, a very good evening, one and all. Honorable resource person, Dr.
George. My name is George.
George Matthew, Associate Professor and Medical Officer, Sport Authority of India, respected Executive Director of Sports Authority of Goa, Sir V.M. Prabhudesai, Director of Coaching, Sir Bruno Coutinho, and all the participants of today's program. It is a great honor for me to propose the vote of thanks for today's program. On behalf of the coaching section of Sports Authority of Goa, I would like to express my gratitude to all the esteemed delegates of the webinar for their presence and contribution in making this webinar a great success. I extend my gratitude to our Honorable Resource Person, Dr. George Matthew Sir, for taking out time from his busy schedule to conduct today's event. Thank you, sir, very much for inspiring and encouraging us. The knowledge shared on today's program will go a long way in helping our participants promptly take the right decision and administer the first aid whenever required on and off the field during emergencies. A special thank to our Executive Director, Sir V.M. Prabhudesai, and Coaching Director, Sir Bruno Coutinho, for providing immense support to make this webinar successful. I extend my gratitude to Ms. Steffi Cardozo, Assistant Project Officer, for organizing the webinar even amidst the pandemic. At last, I thank the organizing team and all the participants for their active participation in today's webinar. This is Yogesh Savaldesai, a Kabaddi coach, Sports Authority of Goa, signing off for today. Thank you and have a great evening, sir, and all. Great evening, all of you.
Thank you, sir.
Thank you very much.
Thank you, sir. Thank you, everybody. Thanks for your time. Goodbye.
Thank you, sir.
Thank you, ma'am. Bye. I'm leaving. Thank you very much.